Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, welcome back. I'm so glad you're with us today. So we are going to be talking about oppositional defiance disorder. And if you have a kid who is oppositional, you know what a struggle it is. So I have a special guest. She is returning for the second time. Today, her name is Dr. Andrea Mata, and she has her PhD in psychology. And she is on a mission to throat punch the youth mental health crisis and equip parents, educators, and leaders with the tools they need to raise adaptable young youth and build resilient communities. Statistically, she shouldn't be where she is today, growing up as the daughter of a Mexican immigrant in a gang-infested neighborhood in the south side of Chicago. But Dr. Mata transformed her challenging upbringing into a source of strength, becoming a nationally recognized psychologist and speaker. She is the author of the number 2 parenting book, Practical Tips for Pooped Out Parents, and a leading voice in promoting authoritative parenting, a research-backed approach that combines high expectations with the warm fuzzies. And her insights have been featured on CNN, The Hall Show, and in Forbes magazine, Wall Street Journal, The Huffington Post, where she offers real-world strategies for navigating parenting, behavior, and mental health with directness and a side of snark. So with all of that, let's welcome Dr. Mata.
I'm so happy to be back.
Yes. Okay. So we're going to be talking about a little bit of a different topic this time. We're going to be talking about oppositional defiance disorder. And I think this is something that is a bit of a mystery to people. So I'm glad that you're here to help us understand.
Yeah, I love oppositional defiant disorder. It is like my bread and butter. So I'm ready.
Yes. Okay. Well, good. We're glad you're here because the rest of us are struggling. We need some help. So, okay, let's start by, I think, for parents especially, like, what does oppositional defiant disorder even mean, right? Like, you think about, like, is this normal? Is this abnormal? Like, it feels bad, but like, what does oppositional defiant really mean?
So oppositional defiant disorder is when kids or teenagers, but it usually comes out in middle childhood and maybe a little bit younger, is when you ask your child or your just any authority figure will ask your child to do something, and they
Mhm.
will write out, say, like, no, I'm not doing it. And even worse, they will do the complete opposite of what you're asking them to do.
Mhm.
So it's like when anytime some kind of an authoritative figure, and that's the reason why I'm putting those in quotations, is asking them to do something, behaves in a way, they're going to do the opposite. So if you're like, hey, put the laundry away, not only will they go and they grab the laundry, but they will like flip the basket over and just stare at you. And you're like,
What the heck?
yeah,
Yes. Probably some other words are on your mind as well.
probably.
Yes. So it's not just being strong-willed, right? Like it's more than that. Tell me, like, can you help me understand a little bit? Because I'm like, parents are like, okay, my kid doesn't flip over the laundry basket, or like they do, like, I'm like, hey, can you get ready for bed? And they're like, they sit down to watch a show. Um, what else can we be looking for?
So it's strong-willed, but then there's also like an undertone of spitefulness and like
Mm,
vindictiveness. So these are going to be the kids. I remember I had one client, his brother drank all of his, so he had like his own little like mini fridge in his room, and his
mhm,
brother went in and like drank all of his drinks out of his mini fridge. And so my client one day, before his when his brother was upstairs, went and took shaving cream and hid, like, shot shaving cream all in his brother's like lacrosse cleats, and didn't tell him. So I was like, wait, so like your brother's going to go to lacrosse practice today. He's going to put both of his cleats on, and it's just his feet are going to be covered with shaving cream. And he's like,
mhm,
yeah. And he was like proud of it. And so it's like that
mhm,
spitefulness, that vindictiveness.
mhm,
The other example I give a lot of the time is there'll be the kids that will take a toothbrush and they will rub it around the toilet bowl and then they will put the person who they're mad at, they'll put the toothbrush back and they won't say anything. And then when that person brushes their teeth, they'll just giggle and laugh. And they may tell the person afterwards, but probably not.
Mhm. Mhm. Okay, so lots of spite, lots of
Mhm.
like like things that we would normally not do, right? Like
Correct.
to
Yeah.
another level, right? Of
Mhm.
like trying to what is the effort? Is it like to get control? Like why do kids do this? Like or why are kids like this?
So a lot of the time, like kids who have been diagnosed with oppositional defiant disorder, it's the perfect interaction, the marriage between
Mhm.
the child having a more oppositional nature to them, because lots of kids have oppositional natures to them. Not
Okay.
everyone, not a
Yep.
lot, but there's a small percentage. So they have that like personality to be oppositional. I have an
Mhm.
oppositional nature personality. I'm just born with it. And then the interaction is if the context is just right. So, like a lot of the time, we see oppositional defiant disorder in kids who have that oppositional nature to them, but then their environment, the authoritative figure, the person who's supposed to be the authoritative figure, has
Mhm.
more of a meek or complacent, submissive persona to them, where the child doesn't see them as an authority figure, and then that's when the child is going to do like a power grab or control grab.
Mm. So is this kind of like when you hear about like wolves, like if somebody's not the pack leader, like somebody's going to become the pack leader. And so if the
Correct.
kid sees that like there's no pack leader here, it's like just an opportunity for them to move to the person in charge.
Yes, as long as they have that oppositional nature. There's gonna be
Yeah.
some kids that they will never kind of grab that to be the pack leader, but
Mhm.
there's those kids that have more of that oppositional nature to them. They're feisty when they're younger, they are strong-willed, those kind of things.
Mhm.
Those are gonna be the kids that are going to, when they see that opportunity present itself, those are gonna be the kids that kind of go for that control, become the pack leader.
Mhm. Okay, so when do we decide that we should get support? Right? So let's say we're like, okay, yes, everything you're saying, I am like, yep,
Mhm.
yep, yep, that's my kid. When do you look for support?
I think once it's if you're noticing that your child doesn't see you as the boss,
Mhm.
um, and they have more of that oppositional nature to them, that spitefulness, that vindictiveness,
Mhm.
that's when it's crossed that line over from like strong-willed to like, okay, they are not listening to a darn thing I am saying. They're flipping over the laundry baskets, they're like being vindictive, they're being spiteful, those kind of things.
Mhm.
That's when I think you're going to want to reach out to a mental health professional or parenting coach who specializes in oppositional defiant disorder. There's going to be lots of people that say that they know how to treat oppositional defiant disorder, but in my experience and the clients that I've worked with, they're like, "Oh yeah, I went to this therapist and they said that they specialized in it, that they knew how to do it, and it didn't do anything." And and
Mhm.
then they're like, "And then we found you." And I'm like, "Okay." And they're like, "And you're different. Like you like we're out in 6 to 8 sessions." And I'm like,
Yeah.
"Yes, I don't want you to be around
Mhm.
forever." Like
Yeah.
opposition defiant disorder is completely treatable. It can go away. We just need probably about 6 to 8, maybe 12 sessions to kind of put in the work.
Yeah. Okay, so I guess I'm thinking like, is there a type of therapy that is best for oppositional defiant disorder?
Yeah, so with what usually surprises a lot of parents, because the parents like, "Here's my child, fix
Mhm.
them." And I'm
Yeah.
like, actually, we have to do parent training." So it's a lot of parent training, and when to kind of get more buy-in from the parents, because if I look at a parent immediately and say, "Hey, you're the problem, like how you're
Mhm.
parenting is the problem, like your kid is not necessarily the problem," they're gonna be like, "We're not coming back." And so a
Right.
lot of the time, to get buy-in from parents, I will tell them like, "Okay, this is what we're going to do. we're to do half our time parent training, and then we're to spend half the time with your child teaching them. And this is what parents love a lot of the time. I'm going to teach them how to make their oppositional nature work for them so that they can succeed. Because like I said, I'm oppositional, and
Mhm.
I've learned over my lifetime, I can make it work for me.
Yeah. Well, it's funny that you say that because I was looking back at testing that my parents had done when I was young, and it came back and said ADHD, which my parents were like, yes, duh.
Mhm.
Yeah, this girl for sure.
Yeah.
But then it had oppositional defiant disorder, and I was like offended initially.
Mhm.
Like I looked at that and I was like, I mean, I just had different, better ideas of how to do something. But I was like, I don't remember being super spiteful, and maybe I was, and obviously it could be a misdiagnosis too, but like I never, I mean, when we were kids, like therapy
Mhm.
was like not a thing that existed. I mean, it did,
Right.
of
Yeah.
course. It was like you didn't send your kids unless something was like really
Yeah.
egregious,
Yeah.
right?
Mhm.
Like it had to
Yeah.
be super bad. You had to really be struggling. And it's like, we're like, I mean, no, you don't have to do like you don't have to make it that hard, right?
Mhm.
Like it does not have to
Right.
be that difficult. But I don't remember ever getting skills, but I do, I mean, like, I do think I've done well. Like I've made it through
Mhm.
that piece. But like there are some kids that without intervention, I mean, you're just gonna suffer,
Yeah.
right?
Mhm. Right. And so I think that's the thing. Like my youngest is a first grader, and some of my favorite times, because it's usually on Fridays, when I pick them up from school, and like all three of my kids like shoot into the Jeep, and my youngest, my first grader, told me this story about one of her classmates who one day just like, I guess she got upset, she got mad, and she went and she took all of the pencils, because like it's like community pencils. She took all of the pencils and she just like cut off all of the erasers from all of the pencils and
Wow.
for everyone. And I was like,
Mhm.
oh. And then every week it's like a new story about like the eraser cutter.
Yeah.
And I'm
Mhm.
like, and then finally they have like a behavior chart, and I'm like, maybe I should like reach out to the teacher and be like, hey, like, do you want some assistance with this kid? Because it seems like they're pretty oppositional. But yeah, like if we don't, and it's so treatable, that's the other thing, and we can teach them to help them learn how to make it work for them.
Mhm. Yeah. Because I mean, we don't have to, I think it's like, I like that idea of like, we're making it work for us because
Mhm.
I mean, there is value in being oppositional to
Oh,
not
yeah.
just take things because they've been said and for you to be like, yeah, I just don't,
Mhm.
mm-mm. I don't agree with that. Like, or I don't
Yeah.
think that's right. Or like, I want more information. Like, I'm not
Mhm.
going to just blindly agree or vote or whatever. Like, or that's not really what happened or whatever. Right. Like,
Yeah.
you are going to be in opposition even to an authority figure, right? Like
Mhm.
your boss to be like, well, that's not actually how it happened.
Right.
Maybe that's why I don't have a boss.
It's probably why
It's
you don't
all
have a boss.
coming full
It's
circle,
all
getting
coming
it
full
right
circle.
here.
Yep.
I'm like, yeah, that just didn't work super well for me.
Mhm.
Um, yeah, but I think, it's figuring out how to spin it so that it's beneficial.
Yes.
How do you get kids to buy into that process? Do you feel
A
like
lot of
venting as a
Yeah.
superpower is helpful?
Yeah, so I can see like I don't know if you ever watched the show Scandal with like
Oh,
Olivia Pope, and she'd always ask like, what is it that you want? It's the
mhm.
same thing with like oppositional youth. It's like, okay, do you want your parents to be nagging you all of the time or as much as they are? And they're like, no, not even close. And I was like, okay, well, then what we're going to do in here is we are going to teach you how to behave in ways that's going to get your parents off of your back. And they're
Yeah.
like, okay, I'm game. Like, let's go. And so that's how I usually get the teenagers buy in is like, okay, what is it that you want? Okay,
Mhm.
you want that. You want your parents to be off your back. You want to be successful. You want more money. You want people to listen to you. Okay, well, then let's develop skills so
Mhm.
that you get all of those things. And I'm going to get you out of therapy as quickly as I possibly can because
Mhm.
I don't want you to be in therapy forever. And
Right.
once they hear that and they know that I'm not going to like kind of hold them hostage every week for an hour for the next like 3 years, they're
Yeah,
like,
sure.
okay, yeah, like
Yeah.
I'll give you 2 months and
Yeah.
I'll, do what you're telling me to do
Mhm.
and I'll try it
Mhm.
out and I'll see how it works.
Yeah. Love that. Okay, so do you find that when kids are oppositional defiant, that it shows up different at school than home, or is it like the same? Like, how does that look?
So, oppositional defiant disorder, how I usually kind of pick it out is that when a child or youth is behaving in an oppositional defiant way in one context, but not in another context. So, that's how we usually, a lot of the time, will
Mhm.
differentiate it from ADHD because a child who has ADHD, they have to be behaving in those ways in multiple contexts. But with
Mhm.
oppositional defiant disorder, we only see it in that context where they don't view the authority figure
Mhm.
as an actual like authority figure. And they
Mhm.
feel like they can just kind of railroad the authority figure and get away with it and like kind of grab that power, like that
Mhm.
pack leader that we were talking about earlier.
Yeah. Okay, so talk to me about the comorbidity with ADHD and oppositional defiant disorder. Is there like an overlap in that, right? Like, do we find that people will have ADHD and oppositional defiant disorder, or is it something that's different or no parallel? What do you think on that?
I think they co-occur,
Mhm.
but I don't think they co-occur as much as people would think. Because again, like you really have to do what's called the differential diagnosis. You have to
Mhm.
figure out, okay, is this behavior happening in this context because there's something that their brain is not allowing them to behave in that way?
Mhm.
Or is it because of the environment and the authority figure, and the environment is not structured in a way where it sets clear expectations and there are clear consequences and rewards and all of those
Mhm.
things.
Okay. Okay, so then talk to me about, I mean, I think if I have a kid that's oppositional defiant, as a parent, I'm going to be like, okay, like you're saying that maybe it's me. What are the things that I might be doing, or what do you find are the most common things that parents are doing that are making oppositional defiant disorder worse?
I think probably the big thing right now is being more gentle. So they're
Mhm.
doing so like when I talk about parenting and like effective parenting styles, I talk
Mhm.
about the authoritative parenting style. So high expectations within the context of the warm and fuzzies. What I see a lot of the time with kids who are oppositionally defiant, their parents tend to go more towards that permissive, or they tend to be super uber high on warm and fuzzies, but
Mhm.
they're lower on expectations. Or they might be practicing more of that gentle parenting kind of parenting style where they're kind of coming in and they don't want to be the boss. They don't want to be the authority figure. I've been
Mhm.
talking with some friends recently and they're like, Andrea, you need to rebrand authoritative parenting. They're like, because it just sounds so like a
Mhm.
domineering kind of thing. And I'm like, it's not though. It's like the loving kind. And
Sure.
so I think the thing is, people a lot of the time, like you have to be the boss, you have to be the authoritative figure, but you're like the loving boss, like you're the one that's going to set clear expectations and then you're going to follow it in with the relationship piece.
Mhm. So, why do you think, why is this type of parenting maybe hard for people to buy into? Because I do think there is the gentle parenting seems more
Mhm,
permissive, right? Of kind of like we're in this together, which I do think we are in this together, but it's
mhm.
like the kid maybe has as much power as the adult has.
Yeah.
Is that
I think that's where gentle parenting that's one of the reasons why gentle parenting goes wrong. It's like, okay, yes, we're in it together, but I'm still the adult
Mhm.
because a lot of the time gentle parenting wants to treat their child as if they're on the same level. And it's
Mhm.
okay as the parent to be at a higher like that authority figure
Mhm.
in your child's life. And I think that's where we're going wrong because a lot of millennials and Gen Xers were parented using what I call like a militant parenting style, like
Mhm.
my way or the highway.
Yeah.
And then we swung completely to the other side where we're starting to see more gentle parenting and permissive
Mhm.
parenting and those kind of things. And we don't want to be the authority figure. We want to be warm and we want to be, kind of
Sure.
loving and nurturing. But that's not like you can have those things, but you have to pair it with the high expectations.
Mhm. So are you saying kids want us to be in control? Like they want to be able to feel like they can kind of lean on us, or like that we're going to hold them accountable, or that there's going to be expectations for their behaviors?
Absolutely. Kids do so much better when they have structure, when they have routine, when they know what the expectations are. Now, they may, because they're kids and it makes sense developmentally, they might try to push those boundaries,
Mhm.
but then you, as the parent, still has to hold those boundaries, still hold those expectations. They're going to push it, and you
Mhm.
still have to maintain the expectations.
Yeah, which I think is hard because
Mhm.
I mean it requires us to be present and consistent.
Yes, which are the cornerstones of parenting. Like, I was having a conversation with parents the other day, and they had just read my book, and the one parent started off, they're like, "I realized what the problem is." I was like, "What's the problem?" They're like, "I'm a couch parent." Because in the book I talk about, like, you can't parent from the couch. Like, you
Mhm.
have to be present, you have to be active with your kids.
Mhm.
It's a front loaded activity, that's what we need to be doing.
Yeah.
And then it's the consistency. Like, and I give this example also in the book where it's like, hey, if your boss came and behaved towards you in one way, like screamed at you one day, and then
Mhm.
the next day was like super kind to you, and then the next day was just like nonchalant, and then the next day, like again, was like mean to you, you would get frustrated because you can't predict
Mhm.
what they're going to be like. And
Yeah.
so if you're inconsistent as a parent, your child can't predict, they can't learn how they're
Mhm.
supposed to interact with you
Sure.
because you're inconsistent behaviors.
Mhm. Yeah, so what if we're consistently just kind and soft and gentle? What if we do that part?
If you have an oppositional kid, chances are they're going to grab the power, they're going to grab the control, and
Mhm.
then you're going to be disrespected, would
Yeah.
be my guess.
Well,
Um
and then I mean, because there are times where we just would like our kids to do the things that we need them to do.
right. Yeah,
And that seems fair. Like get ready for school, right? And they're
exactly.
like,
Right.
no. Or they like just lay in their bed, right? Like and so it's I
Yeah.
think I'm attending to the fact that the parenting style of like I love the warm fuzzies and the
Mhm.
cuddling with my kids and snuggles and hearing how much they love me and telling them how much I love them and all those things. But I think parents need to hear that that part doesn't go away, but that's not the only piece.
Correct. Like that same couple that I was talking with, like they have a teenager who they're showering, but after they're done showering, they're putting on dirty clothes and they're wearing the same like dirty clothes for like days on end. And they're
Mhm.
stinky and they're not brushing their hair and they're not brushing their teeth. And I'm like, you guys, they're like, but we're like loving. And I'm like, great. I love that you guys are loving, but you need to come in with the expectations that like
Mhm.
you are doing these things. And they're like, "But," I'm like, "My they're like, "He's not wearing deodorant either." And I'm like, "My 9-year-olds wear deodorant."
Yeah.
Like, it takes my 9-year-olds literally 15 minutes from the time they leave the kitchen to go upstairs, get dressed, brush their hair, and brush their teeth, and change their clothes and all of the things, and then come downstairs. I'm
Mhm.
like, "Because we've consistently told them these are the expectations, and then once you're done with that, then we can come in with the warm and fuzzies."
Sure. So how do you transition? So if we recognize that okay, we're part of this problem, we need more consistency, we need more structure. How do
Mhm.
we figure out how to do that and then how our kids actually follow through with that part? So if we're like, okay, look, no more dirty clothes. You're not
Mhm.
going to do that. You're going to put those in the basket. You're going to grab clean clothes from here. But this kid is 13. I mean, I'm not going to dress them, right? So
Right.
like how how do we get that transition to happen?
So I think one thing is like you go, and one thing I talk with parents about is like, okay, go in, have a family meeting and be like, okay, I've noticed that how I've been parenting isn't working. And this
Mhm.
is why it's not working. And that's on me. I take complete ownership of that. That is my responsibility. I have not parented well. So moving forward, this is what I'm going to do. I'm
Mhm.
going to set expectations. We're going to figure out what those expectations are. I'm going to communicate them to you in a clear and concise manner. And
Mhm.
then I'm going to tell you, okay, what are the rewards? What are you going to get out of doing these things?
Mhm.
And then what are the punishments? What are the consequences if you are not in line with these behaviors? So I
Mhm.
told these parents, I was like, look, y'all are giving him all of his privileges with no expectations, which
Mhm.
is probably the number one parenting mistake that I see currently, is that parents are giving their kids all of these privileges, all of these rewards, and there's no expectations whatsoever. And the story that I always give to parents is like, look, would you hire, like, you're hiring a contractor to come in and remodel your bedroom or your bathroom, wherever it is in your house? And they look at you and they say, hey, you have to pay us 100% of the fee before we will even get started. Would you do it? And
Mhm.
parents are like, no. Like, I
Mhm.
wouldn't pay thousands of dollars for this person to come in and remodel my house before it's done. Maybe I would give them half, but like not full percent. I'm
Mhm.
like, exactly. I'm like, but now what you're doing with your kids is you're allowing, like, you're paying them, you're giving them the rewards, you're giving them the screen times, you're giving them the tablets, you're
Mhm.
giving them video games, you're giving them computers, you're allowing them all of these privileges before they're actually putting in the work,
Mhm.
before they're doing the expectations. And so that's what I told the parents. I'm like, look, they have to now earn everything. Like, if they put on deodorant, they get 5 minutes of screen time. If they put on brand new, like if they put on clean clothes, they get another 5 minutes of, video game screen time,
Mhm.
those kind of things. And so
Mhm.
they're like, okay, so that's what that family's working on right now.
Yeah. Okay, so I mean, because I think it's hard to think
Hmm.
about like what things really matter to
Yeah.
teenagers these days, and what I notice is it's really just technology and
Hmm.
electronics, screen times, whatever you want to do. I mean, that's not totally true, right? Like I think there are other things
Yep.
that are obviously really important too, but those seem to be the things that like they
Hmm.
feel like they will die if they don't have these things, and we know they won't because we grew up
Right.
without them somehow. um but yeah, I think it's like thinking about like parents don't want to take things away, but it's really
Hmm.
not that, it's just that they're earning them. They haven't
Right.
done the work, so they don't get
Hmm.
the reward.
Correct. Like, you're putting into place, like, you don't have anything. You don't have
Hmm.
access to anything. Okay, you want a phone, you want, screen time, you want tablets, all those things. Okay, well then this is the work. It's kind of like setting them up for a job. Like,
Hmm.
if you're going to go into work at McDonald's, you're not going to get paid the money ahead of time. You have to put in the work and then you're going to reap the rewards.
Yeah, so really we're just helping them to function in society too, of like this is the order that things go, right? You do the work,
Exactly.
you get the reward.
Mhm. Right.
Okay.
Absolutely.
So if you had to name what you think are like the top 3 principles for parenting a child with oppositional defiance disorder, what would you say they are and why do they matter?
I think we talked about two of them already. We talked about consistency. So,
Mhm.
like, being consistent with your expectations, or like in
Mhm.
how you're behaving.
Yeah.
You're going to be present, because parenting is very much a front loaded activity. You have to put in the work ahead of time, and
Mhm.
then you're going to reap the benefits, because once you kind of be consistent and you set up your expectations clearly, then, and you're doing it over and over and over again, and it's a pain in the butt, right? Like, I remember we had friends over, and they have two daughters, and then we have our three kids. And all after we ate, like, all three of my kids took their plates and their cups and their silverware and like put it in the sink.
Mhm.
And my one friend, the male, he looks at us and he looks at our, like, I think at the time she was like 3, and looks at our 3-year-old and goes, "Can you teach my 9-year-old how to do that?" And she's like, "You just put it in the sink." And he's like, "How? But how?" And I'm like, "'Cause we just told them over and over and over and over again. Like, this is the expectation. And then eventually we don't have to tell them anymore because they know it's the expectation.
Mhm.
This is what they do. And then they just do it automatically. So like, I
Mhm.
think that's the exhausting piece. Like, you have to be consistent. You have to consistently tell them, and you have to be present so that when they are acting a fool, you can catch them on it. And then
Mhm.
I think the third one is knowing what your child is willing to work for. So,
Mhm.
like, what are those punishments? What are those rewards that they are willing to put in the work for, and capitalizing on those?
Mhm. So do you do separate punishments, or do you think that that's effective besides just like not having access to the rewards? So like let's say they didn't do what you asked. So they don't get their phone, they don't get their TV time, they don't get their iPad, whatever it is in terms of technology or whatever the motivating things are. Is there additional consequences that you have happen or you suggest?
One of my favorite ones that I've done in the past is, so say they, especially for an oppositional defiant teenager.
Mhm.
So they will, like, the parents would tell like this teenager, "Hey, take the dog out for a walk."
Mhm.
And the teenager would argue with them about how they didn't want to take the dog for the walk. And so what we ended up doing was, however long the task took, like, say, like, the walking the dog took 5 minutes. Well,
Mhm.
now they have to do 10 minutes of chores around the house if they refused and if they argued. So a
Mhm.
lot of the times it's like, okay, well, not only do they get access to that screen time or the TV or the phone, whatever it is, the tablet, but now they have to do an additional amount, because you want to show them, there's that contrast that we want to show them, that like being oppositional isn't working for them,
Mhm.
and being, compliant is going to work for them. So if they are oppositional, now they don't get their TV, they don't get their phone, they don't get their tablet, any
Mhm.
kind of technology, and they have to do double the amount of chores that they would have if they were just compliant. So really like teaching them, like, okay, what is going to be the cost of being oppositional?
Okay, so question on that. So
Mhm.
like they finally do the thing. They were oppositional, right? But
Mhm.
they walk the dog and they do the 10 minutes of chores. Then do they get their reward?
It
Or
depends on what the consequence was. If the
Mhm.
consequence was like, hey, once you do all of these things, then you get your technology, then you get the reward, then
Mhm.
by all means, after they're done with that, well, then that's what they get to do.
Mhm.
But if the consequence, if what you articulated was that you don't get it the rest of the day, well, then they don't get it the rest of the day.
Okay.
It just really depends on what the parameters are for
Mhm.
that you set out with your child.
Yeah. Okay. So really it's a lot about setting the foundation up too when you have that like family conversation of like this is how we're going to do things now.
Mhm, exactly.
Yeah. Okay, so I'm thinking about this and I'm like, okay, so kid probably is going to get dysregulated. Even like you sit them down, have a very lovely conversation, even though they're like, this is stupid, don't really want to do this. But they're like, I understand that this is what you're going to do now. And then you're enforcing the things and your kid is getting dysregulated. I think as parents, it's easy to also get on the dysregulation boat,
Mhm.
right?
Yeah.
Um, how do you suggest that parents help themselves stay regulated when they're experiencing lots of pushback or arguing?
So one of the things that I talk a lot about with like emotion regulation is I talk about how emotion regulation works, or how emotions work. And it's
Mhm.
the idea that, when something happens, there's like a normal bell curve where it's like you increase, you increase, you increase, and then it kind of peaks, and then you will naturally come down. And from the
Mhm.
time that something happens to the time that you naturally come down and you're regulated, it takes about 10 to 20 minutes.
Mhm.
And one of the goals of emotion regulation is to teach you skills so that you are not volcanoing at the top of that peak, right?
Mhm.
And so, and how can we kind of minimize the bump as much as we can with emotion regulation? And so, a lot of the times, what I'll talk with people about is fight, flight, freeze, that system, because that's what's happening when we're dysregulated.
Mhm.
Our body's entering into fight. So, we want to like fight our way out of something. We are trying to flee. So, we're trying to run away, or we're just kind of like playing dead. And so when our bodies are activated in that way, we
Mhm.
need to what's called like complete the cycle. So like our bodies need to kind of do those things in order for them to kind of calm down out of that emotion regulation piece. And so then I talk with parents about, okay, what is ways when it comes to fight, what are socially appropriate ways for you to complete your fight cycle that are okay and that's not going to get you into trouble. So
Mhm.
is that like doing behaviors that are going to mimic fighting? So maybe you have a punching bag, or maybe you have a kicking bag, or maybe you're doing push-ups, because push-ups, mimic for the body at least like that explosive like pushing
Mhm.
behavior. Maybe you're doing sprints, maybe you're jumping, something along those lines, something physically usually to kind of allow your body to mimic and complete that cycle. When we're talking about fleeing or flight, it's like go for a walk. Like go
Mhm.
for a walk, walk for 10 to 20 minutes, kind of table whatever it is that you got dysregulated about, and then come back when you feel that you are regulated. And then the freeze one, a lot of the time is like, okay, so freeze, it's just like go wrap yourself in a sweatshirt that you really like, or wrap yourself in a blanket that you really like, and just kind of be still and quiet for again for 10 to 20 minutes until you feel yourself regulated.
Mhm. So you're saying as parents, we can walk away and then
Mhm.
come back when we're regulated. So
Yeah,
we don't.
because I think this is something that I work with couples a lot on is couples, they want like there's always like not always, but there's sometimes one person that just wants to like solve the conflict right here and is just
Mhm.
like and then the other person like needs time to process. And so
Mhm.
I talk about like if anyone is dysregulated, the whole thing needs to be like tabled and put a pin in and like go walk away, take 10 to 20 minutes and then come back. And so
Mhm.
when with your kids, it's okay to take breaks, especially if you have a partner or like a co-parent with you. Like it's okay to like if you see that your partner is dysregulated, it's okay to like tap in and be like, hey, why don't you go take a break and I will work with them.
Mhm.
And if the kid is dysregulated, okay, go pull yourself together and then we're to come back. It is
Mhm.
okay to take breaks.
Yeah, I think there is maybe a viewpoint that we have to do it right now.
Mhm. No.
And then that's not super effective. When we're all in our emotions, nothing's really going to be solved. And in fact, probably worse.
Right. Yeah,
Yeah.
because then you're gonna say things that you're gonna regret, or they're gonna say things that they're gonna regret, and then you're gonna,
Mhm.
like, just escalate each other, and then it's a whole thing, and nothing gets solved when either of us are elevated.
Mhm. What if your kid, I mean, like, if we're introducing this idea, excuse me, and our kid hasn't really done this before and they're like, "Well, I just want the thing I want." And it's like, "Okay, yeah, that's why we're fighting. Like, I need you to take a break." Is
Mhm.
it modeling for them? Is it something where ahead of time we have a conversation like, "Here's the things you're gonna try." Like, how do we get them to buy into that? Because I think that can also be hard.
I think one of the other concepts that I talk a lot with clients is overlearning. So with these new skills that I am teaching them,
Mhm.
they need to be practicing them when they don't need them so that they get really really good at them so that when they do need them, they know how to do them.
Yeah.
Because a lot of the time, a lot of my clients will be like, "Well, I forgot to do the skill." And I
Mhm.
was like, "That's why I want you to be practicing these skills on a daily basis, even when you don't need them,
Mhm.
because then when you actually need them, your
Mhm.
body and your mind will know to do the skills."
Yeah.
And they're like, "Oh." And I'm like, "Yeah. So this is
Yeah.
why we're, doing progressive muscle relaxation every night
Mhm.
before we go to bed for a week. This is
Mhm.
why we're doing all of the relaxation techniques that I'm teaching you. We're trying them out every single day, even when we're not,
Mhm.
dysregulated or when we're not anxious."
Yeah. Yeah, totally makes sense. And I think that's hard, but it makes sense why we do that, because if we don't practice it, there's no way in the height of the motion that our brain is going to be like, let's try out that skill that I've never used before.
Right.
This sounds like the perfect moment.
Yeah,
I
exactly.
don't think we ever do that. We're like, I'm going to do something that I've always done because that's what's the easiest.
Correct. And that's what we're used to doing.
Yeah.
Whereas like, okay, just do 5-2-8 breathing, where you're inhaling through your nose for 5 seconds, you're holding for 2, and then you're exhaling through your mouth for 8 seconds. Unless you're practicing that on a regular basis, you're not going to think, oh, let me do 5-2-8 breathing. That's what I'm supposed to do. No, you're just going to be like, and then it's going to make it worse.
Yeah, totally. Okay, so I'm thinking about families who are like, okay, I have this oppositional kid. It has been really challenging. I'm feeling really awful about parenting. I'm not enjoying this kid very much, or not enjoying parenting very much. What do you think? You kind of insinuated that there might be some hope for these kids, that this is overcomable. Like what is the long-term outlook for kids with oppositional defiant disorder look like?
I think if you get appropriate treatment, they can live a super successful life, because again, they have kind of that superpower of being oppositional and like standing their ground and being assertive. But if you're going to, kind of stay in your feels of like, this feels bad, like the person's going to tell me that I'm parenting wrong, those kind of things, I get the uncomfortableness of it. But at the same time, you're just going to stay stuck. And so it's like, I understand, go out, meet with a mental health professional who's an expert in oppositional defiant disorder. And then in 6 to 8 weeks, your life could look completely different. So whenever you're watching this, 2 months later, it might look completely different if you put in the work and go over that, deal with that uncomfortableness of going and meeting with a mental health professional.
So what I hear you saying is oppositional defiant doesn't just like necessarily go away. So if we don't treat it, like let's say we survive the teenage years and then we have somebody who's 20. I mean, are they, as their frontal lobe is developing, is this something that will go away, or does it not work that way?
I mean, I think it'll go away when it comes to parenting, because they'll be out of the house,
Sure.
right? And then there won't be the expectation, like you won't be putting as many expectations on them as you did before. But then if they go and they work for a boss who maybe doesn't know how to set expectations and is a little bit more meek, a little bit more submissive, well, then what's going to happen is your child is not going to do very well in those situations, because then they're probably going to be oppositional and they're not going to know how to make it work for them. So it can go away with proper treatment, but it can also be lifelong if we don't kind of treat it when we need to treat it.
Yeah. I think it's important to remember that, because sometimes parents are like, well, I mean, they're 16. It won't be a problem. I mean, much longer. We can like deal through this. We've done it this far, which I mean, sure. But just to know that it's not going to just magically go away. It's not about like brain development necessarily. Obviously, our brain developing is an important part of us becoming adults and all the things. And now, I mean, as we're hearing where they're moving our frontal lobe development to like 30, right? Like it's, so like waiting that long, but it's not even really about that. It's about figuring out how to navigate expectations and responsibilities and being able to comply to things. Because there are things that as adults that we don't want to do, but we have to do.
Right. Exactly.
Right.
I think that's,
yeah. I mean, yes, to so many things that I don't want to do, but you just have to do them. Right. And it's not that any of us are like, you know what? I love paperwork. I love it. Like, I don't know. Do you love paperwork? Yeah.
I hate paperwork. It's the bane of my existence. If I could like have someone else do my paperwork, I totally would do that.
Oh, yes, 100%. Yes, that is like the thing I dislike about my job the most. I mean, that's like really, if I could just get rid of that, everything would be great.
It's like a lot of the time I'm like, maybe I should just start doing like coaching instead of like therapy, because then like there's not,
they don't have to have notes.
They don't have to do notes, but like we have to do notes.
Yes.
And then and the other thing is, it's like, and here's the oppositional nature in me. Does anyone actually read the notes?
Yeah. Maybe.
maybe, but maybe not. So now I'm just doing this task
Mhm.
that it doesn't help my clients in any way.
No.
And it doesn't help my clients in any way. It eats up probably at least an hour to 2 hours a week,
Yeah.
and it's not pleasurable, and no one reads it.
Yes. Yes. I'm with you. Yeah,
Mhm.
but we still do them. Yes.
Yep,
So we have to
exactly.
have, I mean, there are things that we just have to do. And so
Right.
we have to also raise kids who can tolerate doing things that like you just have to do.
Yeah,
Right. I
exactly.
mean, yes. I mean, doing laundry, I don't mind doing laundry, but putting it away, do not like that part. Right.
Yeah.
And I could live out of baskets, right? That's a choice. Right. But
Mhm.
it's also good to just like put it in your closet so you can find it more easily or put it in the
Yeah.
drawers or whatever. Like there is an easier
Mhm.
way. And I think, yes, that oppositional nature is just to be like, no, I'm
Mhm.
just going to do it the way I want to do it. And you can't
Right.
make
Exactly.
but then we're figuring out how do we make that happen?
Mhm. Yeah, exactly. And I think that's the thing. Like that was the question that I would always ask when I was at Boys Town, which is like some of the most antisocial and aggressive teenagers
Mhm.
in the nation. And I would look at them, I'm like, and they tell me like what they did. And I'm like, how's that working for you? And a lot of the time, after I said that question to them, a lot of the time they're
Mhm.
like, "Rah, rah, rah, rah." And I'm like, because you know it's not working for you. So if it's not
Yeah.
working for you, let's do something about it.
Yeah. Yeah. Which I think is, I mean, I think most we want to be successful. Like we want to feel happy. We want things to be in harmony, and that's not always possible. But like
Mhm.
when we're causing that, whether it's on the parent front or the kid
Mhm.
front, I mean, we want it to be in harmony. Like when you come home, you want things to be balanced and feel
Yeah,
good, and it's
right.
possible.
Exactly. In 2 months.
Yeah.
I think that's the thing. Like I remember it was interesting because I had two clients, both oppositional defiance disorder, about the same age, and
Mhm.
both of them started at the same time, around the same time.
Mhm.
And one couple like bought all in, they did everything that I did. They were gone in 6 sessions. Like they're like, this is amazing. And I'm like,
Mhm.
yeah. And then the other one, like the parents were pushing back and they like kept wanting me to work with the child, wanting me to work with the child, wanting me to work with the child. And I'm like, no, no, like I need to work with you guys.
Mhm.
And they kept pushing. And then
Mhm.
finally, like they didn't come back because there was one day that like I said something that they did not like.
Mhm.
And so then they were like, okay, we're not like, they just never scheduled another appointment. And I was like, okay, like you guys are going to continue to have a rough life when you don't need to have a rough life.
Mhm.
Like life
Mhm.
could be so much better.
Yeah. Okay. Yeah, and I totally agree. I love this. Talk to me about like, is there? It sounds like what I hear you saying is parent coaching and kid coaching, right? Like giving
Mhm.
the kid
Yeah.
information, giving the parent information, applying those things. Is there a place where medication is supported in the research with this diagnosis or school supports? Is there anything else that you feel like is really effective but outside of what you're already
So a
just
lot of the time medication like does not work for oppositional defiant kids.
Mhm.
Because there's not like a neurotransmitter that's causing them to be oppositional.
Mhm.
Now there's probably more research that's coming out that's looking at more of that like that functional medicine piece that's coming out, but it's so
Yeah.
new that we don't necessarily know, but it's, inflammation in the body and gut health and those kind of things coming out and is like showing some oppositional, but it's probably and maybe it's just my training, but it's not going to be the thing that like immediately go to. Like
Mhm.
I'm immediate. Like if I have an oppositional kid, I'm not going to be like, okay, let's do all of this testing to look at their gut
Mhm.
health and their inflammation and how their
Mhm.
body, the biology. Even though
Yeah.
I have a friend who, if she listens to this, she's going to be like, Andrea, like Um, but like my thing is always going to be, I'm going to look at the parenting. And
Yeah.
then I'm going to do parent coaching. And then if you do what I ask you to do, and I know I'm confident that you're doing what I ask you to do and you're doing
Mhm.
it, and there's still not a change, then I'm going to be like, okay, then maybe we need to start looking for other explanations
Mhm.
other than it was your parenting.
Sure. Yeah. Okay. Makes sense.
Mhm.
Is there do you think that there are things that schools can do? Like, can teachers model the same kind of stuff of having, like, clear, consistent expectations and that helps with school behavior?
Yeah. So it's the same. So the same principles for parents
Uh-huh.
in school. So like if a teacher has a child who's oppositional, a
Mhm.
lot of the time I start to look at and I start to ask, is the teacher an authority, like an actual, like, does the child see the person as an authority figure?
Mhm.
And so I remember one of my friends, one of their children was struggling and they were being more oppositional. They weren't doing what they were supposed to be doing. And I was like, what's the teacher like? And my friend described the teacher. And I'm like, oh, so the teacher's a little bit more meek, a little more submissive, not really an authority figure. And she's like, yeah. And I was like, that's what's going on. But in that case, like, we can't switch classrooms at that
Right.
point. And
Yeah.
so like at that point we needed to, work with the child because that's what we had. So we had to
Mhm.
work with the child in order for the child to become more compliant in the school. But absolutely, the teachers, a lot of the time, teachers, if they have a more oppositional nature or child, and the child's being oppositional in school, then maybe it's time to start looking at how that teacher is coming off. Maybe that teacher is
Mhm.
not setting clear expectations. Maybe that teacher is too high on the warm and fuzzies and needs to kind of back up just a little bit and then set those high expectations high
Mhm.
again.
Okay. And I'm thinking like, yeah. So like when we sometimes at school we get to choose or like not choose who our teacher is, but like
Mhm.
let the administration know about our kid to say like,
Mhm.
hey, this is how our kid does well. Is that
Right.
something if you have a kid who's more oppositional, that would be something like I need a teacher that has
Mhm.
structure and consistency and these kind of things? Is that a helpful recommendation?
Yeah, I think so. And I think the schools will appreciate it because I've been on lots of school meetings as well with kids that are oppositional defiant and they're like, what am I doing? And I remember I had a meeting, it was actually this school year, and I was like, look, whichever his teachers, because he's in like junior high now, I'm like, whichever his teachers are like meek, like those are going to be the classrooms that he has a problem in, that you're going to have a problem with him because he's just going to do a power grab. He's not going to listen to what they're saying. I'm like,
Mhm.
so you all need to be consistent and you guys need to enforce the expectations across all of his classes, or
Mhm.
else his oppositional nature is going to come out.
Yeah, makes so much sense. Okay, so what have I not asked you that you feel like is really helpful to parents to know?
Um, I mean, I think you did a great job asking questions. I think the thing is, it's like, okay, so like you gave that example, Bryce, of the 16-year-old, right?
Mhm.
Like, oh, they're 16. Like, why would they're going to be out of the house in 2 years?
Mhm.
Well, to me, it's like if someone is giving me the option of like in 2 months, our life could be significantly different
Mhm.
versus I'm going to have to like withstand this for the next 2 years.
Mhm.
Like, I know that like the cost of like putting in the work now, that's a cost, right? Where we
Sure.
can just stay the same and continue down this road that we've been at for 2 years. But like overall, what is the cumulative cost? And so, like, that's what I would encourage parents. Like, there is help, and not everyone has got, I mean, no parent got a playbook, right? No kid
Sure.
comes with a manual,
Mhm.
especially for oppositional kids. And so it's like I get you're to feel feelings, and it's like, okay, we'll feel those feelings, but then do something about those feelings and get the
Mhm.
help that you need because there is help out there.
Yeah. How do we know if somebody is, I mean, because people can say they're qualified to treat something. How do we know if they really are?
I think how a lot of the time I've like, because I live in Ohio, so I've had people all around the state of Ohio like find me, and I'm
Mhm.
like, how did you find me? Like, you all are 4 hours away,
Yeah.
and obviously like we did virtual. They're like, there was a like some kind of blog or listserv or something for like
Mhm.
kids, teenagers with oppositional defiant
Yeah.
disorder.
Okay. So looking out for other
Hmm.
research, maybe to other parents that have had a similar personality style with a kid or a diagnosis, asking
Hmm.
maybe your pediatrician.
Yeah,
Yeah. So looking for places where people have had success.
correct. Yeah.
Amazing. Thank
Mhm.
you, Andrea. This has been such a great conversation and I know so helpful to so many people.
Awesome. Thanks for having me, Bryce.
Thanks again, Dr. Mata. That was such a great conversation and so much good information. I think also filling our audience with hope that you can work through this difficult process with your child and yourself by addressing your parenting and also getting some tools for your kiddo. And that the key is to finding the right type of practicing clinician. So with that, I will say thank you so much for your time today. Please, if you felt like this episode was helpful, please share it with a friend. And if you would subscribe to our show on whatever platform you listen on before you go, that would be greatly appreciated. It helps us to get better guests and it grows our audience. So I so appreciate it. And then you'll also be alerted when new episodes come out. And also, if you would like to subscribe to our show on Facebook, YouTube, TikTok, and Instagram, that would be awesome as well. Have a lovely day.
Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.